All right, at this juncture, now let's hear some kind welcome remarks from the head of the Occupational Safety and Health Center. Ladies and gentlemen, a round of applause for Executive Director Noel C. Binag.
Magandang umaga sa inyong lahat, mga kapatid, mga kasama. Good morning to all of you. Sana hindi kayo nabaha. Okay, I'm very pleased to welcome you all in our kamustahan in Region 6, spearheaded by our regional officer, Melvin Melicoton. Melvin, thank you very much again. Napakasipag mo, Melvin. Hanggang ilan episode kaya tayo makakarating? Baka episode 100. I'm truly happy for your accomplishment, Melvin. Sana tuloy-tuloy itong ating mga kamustahan. Because the information that you are giving to us will not only serve Region 6, it will also serve all the other regions in the entire country. So this is a very unique topic, very special topic, and I know, especially in Region 6, that this is the most prevalent industry. So we are here today. Hopefully, we will learn more about occupational safety and health hazards. Ano mga hazards present in the food and beverage industry. I hope our resource speakers will be able to explain to all of us the importance of safety and the importance of promoting the health of our workers. So ayaw po natin magkasakit, lalong-lalo na ngayon, pandemic. We're really in a dire problem now because of the pandemic. Productivity is suffering. Marami pong hindi nakakapasok. So the income earning capacity of the workers are compromised. So, napaka-importante. Hopefully, while waiting for a better opportunity, we welcome you to this kind of seminar, kamustahan. Hopefully, with the limited time, you are able to apply all the knowledge in order to safeguard and to ensure that the workplace is always safe. So, lagi po natin tandaan, the objective of this training is to prevent or eliminate injuries, to prevent and eliminate illnesses to happen in the workplace. And hopefully, I'm inviting everyone, if you have never been to a safety officer training, mga kapatid, meron po tayong SO1 trainings, one-day training, meron din tayong 40 hours training. Feel free, I'm inviting you to visit our website to learn more about the schedules being offered by our safety Occupational Safety and Health Center. Just feel free to visit us, and hopefully you join us in our number of future trainings. The requirement for the Department of Labor and Employment now is for you to have a safety officer in all workplaces now, regardless of size, regardless of classification, whether it's high risk or highly hazardous establishment. We welcome the initiative given to us by our REUs for providing this special knowledge. And hopefully this will not be the first and the last. And I'm also encouraging our other REUs to continue working hard. Lahat po ng REU natin, let's focus on providing free SO1 trainings and free kamustahan seminars. So napaka-importante po ngayon. We're now reaching out to the informal sector. We are now reaching out to the most marginalized sector of the society through giving free mandatory trainings. So kaya na po natin abutin ang ating mga kababayan, kahit yung mga nasa abroad, who are now working abroad, who have left behind their families. Hopefully, we can reach out to them via this webinar. And I hope this is linked to Facebook. Napaka-importante nito, Melvin, that it is linked to our Facebook account so that it can be viewed in all parts of the world. Truly I've been hearing a lot of positive remarks from our stakeholders for our initiative to conduct kamustahan. Napaka-importante. This is now currently running at episode 3, just like in any television series. Meron kang season 1, Netflix, season 2, Netflix. Maaring ganyan kung makakarating tayo ng season 5 sa ating kamustahan. So ating mga kapatid, I'm encouraging you to join SO1 trainings, SO2 training, course, boss, and hopefully you will become an accredited practitioner and consultant. Ako po ngayon nasa Isabela to help in the operation of the relief operation because mga karamihan mga kababayan natin dito have suffered a lot and they now, although the water have receded, but there's still a lot of problems, especially on the economic problems confronting them. They don't have any means to survive. So, pagdasal po natin sila, ipagdasal natin ang ating mga kababayan, less fortunate kababayan who have been affected by this flooding. So, napaka-importante po yan. And to you mga kapatid, enjoy the day, enjoy being with us, especially with our REU6, Melvin. Very creative si Melvin. Pwede na siyang ipalit kay Wawawi. Pwede na natin siyang gumawa ng programa ni Wawawi. To all of you, mabuhay po. Remain healthy, remain safe during this pandemic period. And hopefully, together, we are able to survive this crisis. All of us, sama-sama, ang sabi nila, walang iwanan. Nobody will be left behind. Thank you very much.
Thank you very much, Executive Director Noel C. Binag, for kind welcome remarks. Always ever supportive po dito sa Region 6. Thank you very much, sir. Now let us be inspired and be driven with passion by an inspirational message from the head of the DOLE Regional Office 6. Ladies and gentlemen, proudly Ilonggo, Regional Director Cyril L. Ticao via a video presentation.
Good morning, everybody. First of all, I would like to express my gratitude to the Occupational Safety and Health Center, headed by, of course, by their ever dynamic Executive Director, Noel Binag, for this initiative. In this trying time, the government is still trying its best to extend its assistance, and this Occupational Safety and Health session via webinar is a concrete example. We must still continue to educate our stakeholders on the importance of occupational safety and health, even in the new normal condition. It is because safety cannot be compromised, especially in this time. Let me also thank all the participating companies and organizations who participated here today. The public information campaign is very timely. I believe that for us to develop safety and health advocates, we should always start from making people aware of the importance of these practices in the workplace. In this gathering, you will have the opportunity to learn from our speakers and learn from the best practices in the industry. In the year 2018, marked a historic event for the safety practitioners and advocates because of the passing of Republic Act 11058, or the Act strengthening compliance with occupational safety and health standards and providing penalties for violation thereof. This law is a manifestation that the safety of our workers in their workplace is of great importance. We also recognize in the department that our vision for a safe workplace for all workers could not be achieved without your cooperation and help. This vision and goal will take more than just our effort. We have to be united, and with this kind of gathering, we are one step closer to that goal. On our end, we are currently in partnership with DTI in conducting monitoring of establishment. in compliance with the interim guidelines of DTI and the Department of Labor and Employment on workplace prevention and control of COVID-19. This is to protect our workers from contracting the virus when they are at work. We make sure that every worker is protected from unsafe practices. Again, we do not compromise. And with this advocacy campaign, it is our hope that you will walk out from this venue with the passion to promote safety and health in your workplace. We hope that you commit and improve your policies, especially about the health issues that will be discussed in this training. So with that, I would like to once again thank everyone. Your presence here today shows your desire and commitment to your respective organization. After all, we are bound by our commitment to serve. We are here for a greater goal, and that is for every worker to have a safe workplace. Mabuhay ang mga kagawang Pilipino. Maraming salamat.
Thank you very much, Dole Regional Director Cyril L. Ticao, for your inspirational message. Now at this time, I call on Mr. Junel John Moleño, our Regional Public Information Staff, to acknowledge the participating organizations who are with us right now.
Hi, good morning, everyone. I have the privilege to acknowledge the participating organizations who are with us right now. Let me acknowledge my coworkers from the Occupational Safety and Health Center, the dynamic REO representatives throughout the country, my DOLE family members, my fellow public servants from various government agencies, the Western Visayas Occupational Safety and Health, the Safety Organization of Negros Occidental Incorporated, the Boracay OSH Network, Tri-Safety, Courtyard by Marriott Iloilo, Housekeeping, Shakey's Haro, Mang Inasal, Pepper Lunch, Zark's Burger, Jim's Recipe, Jolly Management Solutions Incorporated, Lechon House Food Corporation, Pepsi Cola Product Philippines, Goldilocks, Rastan Coffee Corporation, Bistro Carcosa, San Jose Bake Shop, Yam Chow Restaurant, Crave Food House, Bread of Life Keto Pastries, Hotel Del Rio, MPA Hotel and Resorts Incorporated, Sicogon Town Hotel Incorporated, Iloilo La Festa Hotel, Green Sun Hotel, owners and safety officers, HR managers, company representatives, OSH champions, and advocates who are online right now. Thank you very much for your active support and participation.
All right, thank you, Sir Junel. Now we move on to the session objectives, wherein now at the end of the 2.5 webinar session, participants will be able to, number 1, recognize industry-specific OSH guidelines. Number 2, compare industry-specific OSH compliance guidelines versus current workplace scenario. Number 3, identify challenges in the workplace on OSH compliance. Then number 4, note industry-specific best practices on OSH. Now, in order to make this session a success, may we please ask for cooperation regarding our session rules, wherein number 1, please be courteous to everyone. Number 2, stay on mute if you're not talking. Number 3, do not use the meeting chat box for conversations not related to the session. Number 4, all questions and clarifications will be answered during the Q&A segment. Number 5, if you will experience any technical issues, please inform the facilitators via the chat box. Then number 6, a certificate of participation will be provided for registered participants who successfully submitted the post-activity evaluation forms. Now moving on, we proceed to the first topic for today. This will be a 30-minute topic on OSH compliance and guidelines in the food and beverage industry. Now our resource person is a licensed chemical engineer who has been with Mondenison Corporation for 10 years as a QC head. Also 5 years of experience as an industrial hygienist 3 of the Occupational Safety and Health Center. Also a previous senior OSH Inspection Officer under the O section of the Public Health and Safety Department of Dubai Municipality in Dubai, United Arab Emirates in 4 years. Now currently she's the Regional Program Manager of the Occupational Safety and Health Center Regional Extension Unit number 8. Ladies and gentlemen, please help me welcome Engineer Maria Elena L. Diaz. Engineer?
Sir Max, good morning. Thank you so much, Sir Melvin Melocotan, for that kind introduction, heartwarming introduction. So, to our 188 participants, a pleasant morning to everyone. To our beloved regional extension units who are here today. Okay, so good morning to everyone. I'm sorry, I just came in. Am I supposed to start my presentation already, Sir Melvin?
Yes po ma'am. You may
Okay,
start
my
po.
apology for that. I had my uh, uh, personal break, okay, before the start of the session. Anyway, now allow me to share with you my presentation. Okay, so again, good morning, everyone. Good morning, of course, to our Executive Director, Noel Sibinag, and the heads of the regional extension units. Good morning. Our participants who are here today, once again, good morning. So thank you so much for inviting us, Sir Melvin, Region 8, to be your resource speaker on the OSH compliance and guidelines in the food and beverage industry. So today I will be discussing with you with the OSH indicators. What are the things that we need to consider, okay, when we talk about the compliance of the food and beverage industry to the requirements on occupational safety and health? So first thing foremost, we have to determine who are the food and beverage industry. So basically, as defined, the food and beverage industry are industries involved in processing raw food materials, packaging, and distributing them. This includes fresh, prepared foods, as well as packaged foods, and alcoholic and non-alcoholic beverage. So I believe most of our participants here today comes from this particular industry. So any product meant for human consumption aside from pharmaceuticals. So they are considered to be part of the food and beverage industry. So what are the requirements that are specific for the food and beverage? So you might be wondering, is there a specific requirement just for the food and beverage industry when we talk about occupational safety and health? So the food and beverage industry, same with other industries actually, they shall comply with the requirements of the Republic Act 11058, also known as the Act Strengthening the Compliance of the Occupational Safety and Health Standard and providing penalties thereof. And of course, it's implementing rules and regulations, or the DOLE, Department Order number 198 series of 2018. Now, every industry have its own peculiarities. Iba-iba po yung mga hazards, iba-iba pa yung mga risk that the workers are being exposed to in a food and beverage industry. It doesn't mean that they have the same, for example, they are the same bottling companies. They already have the same hazards. No, they have different hazards and different level of exposure. So the risk also varies. So there are no two industries that are actually totally the same. So hazards and risk of each industry differs. Thus, the policy and programs are also in variations. So we will be talking about this. So some of these indicators that I'll be discussing today might not be applicable to you, but you have to check whichever indicators will be applicable to your organization. Because as I mentioned, it varies from one organization to the other. So Today, we will be discussing the different OS indicators that you should look into, not just for compliance. So, na-mention po kanina ng executive director natin that it's not about compliance on safety and health, but we ultimately want to ensure that our workers are always safe. So, we want to ensure that there will be zero accident in the workplaces, as well as zero work-related illnesses. So therefore, there is a need for us to ensure that our workplaces are always safe and our workforce are always safe and healthy. So we will be discussing the OSH indicators. The first is, this is mandatory, of course, to all establishments, regardless of the number of workers. So first, you have to make sure that you have the registration of your establishment per Rule 1020. Okay, so first thing, your employer shall register his business to DOLE so that your organization or your establishment should form part of a data bank of all concerned establishments or covered establishment, I mean. Now, registration must be done it must be done 30 days prior its operation. So, hindi pa man nag-start yung operation natin, okay? So, dapat na-rehistro na natin ang establishmento natin sa DOLE. Now, the requirements, all you have to do is just check DOLE website, look for the Rule 1020 registration form. You have to fill it up. All forms are downloadable from all DOLE websites. Together with it, you have to attach the layout of your workplace. Okay, so the floor by floor layout of your workplace, showing all physical features of the workplace, including the storage, exits, the aisles, machineries, emergency devices, and locations of these devices. So it should be there in your floor plan. And it should be a scale of 1:100 meters. So it can either be in white or blueprint. And you have to attach also your copy of a business permit. Now, this particular registration is free of charge. So don't worry, you have to register and wala pong bayad ang magparehistro. So pinakauna po yung requirement natin para lahat ng programa ng DOLE ay kasama po kayo sa ating mga sa database natin for all covered establishment. So yan yung unang requirement natin to check for the OSH compliance indicators. The next thing for us to consider is to check if we have the OSH policy. Okay, so we call it also the company commitment. So you should have a written company commitment, your employer's commitment to comply with the occupational safety and health requirements, or the written statement by the employer now stating the company's commitment, okay, for the protection of the health and safety of employees and to the public as well, also known as the company's OSH policy statement. So marami sa ating alam na policy statement po yon. Okay, so that's the company commitment. Because if there's no company commitment, the commitment of the company, hindi po magagawa lang ang mga programa ng isang establishment or ng company if there's no commitment coming from the employer themselves. Okay, so a written occupational safety and health policy actually helps promote an effective OSH program. Such a policy should reflect the special needs. So ano ba yung mga special needs in your establishment, in your company, in your workplace? And should be regularly reviewed and updated. So minimum for this, you can do your review once a year or as deemed necessary. So this communicates a commitment to health and safety and should be signed by the highest ranking official in your company, di ba? So dapat yung pinakamataas na official in your company, siya pong mag-signify his commitment that they are committed or the organization is committed to protect the workers at all cost, okay, in terms of safety and health. So that's it for our second OSH compliance indicator for your OSH policy statement. So check mga kababayan kung meron na ba kayong policy statement. Kung wala pa, well then I think it's not too late to start writing one. The next we have the general safety health programs. So kailangan po lahat ng establishmento ay may mga programa on safety and health. So first thing is you have your HIRAC or the hazard identification, risk assessment, and control. Now, all establishments are required to have this and should be submitted to DOLE. Now, the conduct of the hazard identification, risk assessment, and control is very essential in the prevention of accident and illnesses in the workplace. Okay, it will determine what hazards are present at the workplace. Okay, gaya ng food manufacturing industries, the beverage industry, ano ba yung mga hazards na present in your workplace? So you have to determine what are these hazards. And once identified, you have to establish control measures. So these controls of exposure to this hazards should be detailed in your safety and health program. So lahat po ng mga hazards, kaya kailangan po well-versed po ang mga personnel who conducts the hazard identification, because that is the very essential part also in doing the HIRAC. You have to determine the right hazard for you to be able to implement the right control measures towards those hazards. Now, this will help you also in the determination of your company's risk classification, di ba? It is the responsibility of the company to do their own to determine their own risk classification. So ano ba kayo? Are you low risk? Are you medium risk? Or are you a high risk? So yan po ang gamit din ng HIRAC, okay? It is important for us to know the risk classification for a company because there are numerous requirements that needs the information of the risk classification. Example, you need to know what is your risk classification if you want to know how many safety officers are required in your organization. You need to know how many occupational health personnel. So one of the criteria to determine on the requirement for safety officer and occupational health personnel is you have to determine the risk classification of your establishment. So very important po yung HIRAC, ang pag-conduct ng HIRAC sa workplaces natin. That form part of your general safety and health programs. So of course, aside from HIRAC, you also have to conduct the medical surveillance. Now, for optimizing employees' health, this is also to detect and eliminate underlying causes such as hazards or exposure of any discovered trends, okay? And thus have a prevention focus. So conduct natin, ano ba yung mga prevalent mga illnesses in our workplaces? Because it varies from one industry to the other because you have peculiarities, you have different hazards, you have different equipments, you have different layouts. So most likely, you have different hazards and exposures. So in this, the conduct of physical examination also are required. So we know that examinations such as pre-employment is mandatory, is required. Your periodic annual examinations is also required. So pwede po yon annually, at least once a year ang required dito, magkaroon ng physical examination and other examinations depending on the risk involved in the workplace. So depende, meron tayong, like for example, if you have exposure to lead, meron tayong mga special examination for the blood lead. Okay? So depende po kung ano yung mga exposures ng workers natin. There are other special examinations that is required for your workers to undergo. And that is part of your medical surveillance also. So on top of that, pwede po din po tayo, may required po tayo na mag-conduct po tayo ng random drug testing for the establishment. Later on, I'll be discussing with you that there is also a requirement for you to have a policy and program on drug-free workplace. But this one on it states that you have to have drug testing for establishments, especially for those establishments that have greater than 10 workers. So yun po nakalagay pag 10 and more workers, mandatory po na meron tayong mga kinakandak na random drug testing para sa establishment natin. So sabi na, why do we have to conduct random drug testing? Because, you know, there are accident that happens in the workplace that is actually linked to workers who are under the influence of drugs, di ba? O prohibited drugs. So that's the reason why we have to do this also, because this is a prevention aspect when we talk about occupational safety and health. Now, for the requirement of your first aid emergency medical services, so meron tayong one requirement is for you to have the medicine cabinet or the medicines. So for you to know ano bang mga medicines na kailangan namin sa workplace namin. Now, this requirement also depends on the number of workers that you have. Okay, so you can refer this to table 47 of the list of medicines in our occupational safety and health standard. So first aid, ano ba mga first aid facilities ang kailangan natin? So later on, i-discuss din natin yan kung ano-ano mga facilities requirement as part of your OSH compliance. Okay? So next is we have the requirement of the policy and program on the promotion of drug-free, or as mentioned kanina, policy and program on the promotion on drug-free workplace. Okay, so this is actually pursuant to DOLE Department Order Number 53, Series of 2003, known as the Guidelines for the Implementation of Drug-Free Workplace Policies and Program for the Private Sector. Now, this is actually mandatory to all establishments with more than 10 workers, else if less, it is only encouraged. So yung mga workplaces na mayroon less than 10 workers, okay, you don't have to have a written policy on the drug-free workplace, okay, but you are encouraged to have a written one, okay? So your policy should include advocacy, okay? You have to inform your workers what are the ill health effects of drugs, okay? Effects to the workers, effect to other workers, ano epekto sa trabaho. Okay, you have to do education and training. You have to conduct the random drug testing. And meron tayong kung sakaling nagkaroon ng positive, meron tayong mga treatment, ano ba, paano natin gagawin, paano natin i-assist si worker on the treatment and rehabilitation. And of course, you should have your referral system also. Okay? So next is we have the mental health. Ito bago lang po to, di ba? Just this 2020 na-release po yung implementing rules and regulations as well as yung DOLE Department Order Number 208 Series of 2020 nga. It is the guidelines for the implementation of the mental health workplace policies and programs for the private sector. So actually mandatory ito sa lahat ng mga establishmento. So lalo na ngayon sa panahon ng pandemya. Okay, so we have to be very keen. Okay, dahil po marami pong affected na in terms of their mental health, affected din because of this COVID-19. So we have to make sure that we are also compliant with DOLE Department Order Number 208. Okay? So, and of course, we have to promote healthy lifestyle among our workers. Okay, so yung mga exercises, that's very good. Having Zumba every day in your workplace or providing facilities for them to exercise, that is good also. And conduct of training also. You have to inform your workers that there are certain lifestyle, okay, so that is not good for our workers. Next is policy and program on the prevention and control of HIV and AIDS, tuberculosis, hepatitis B. Now, the prevention and control of HIV and AIDS pursuant to DOLE Department Order 102, Series of 2010. And of course, this is in accordance with Republic Act 8504. Now, this particular policy and program or prevention and control should form part of your OSH program. Diba yung OSH program natin, we need to have our own occupational safety and health program. And this program should be submitted to DOLE. Dapat po lahat ng establishmento ay sinasubmit yung OSH program nila sa DOLE. So part po ng program natin is your policy and program on the prevention and control of HIV and AIDS. So makita po niyo doon sa department order kung ano bang kailangan mga components doon sa program natin. And of course, our policy and program on the prevention and control of tuberculosis, Pursuant naman ito sa Department Order Number 73, Series of 2005. Now, your TB prevention program shall contain the prevention, treatment, rehabilitation, compensation, restoration to work, and social policies. Kasi marami po tayong mga workers nagkaroon ng TB, tapos po nagkakaroon ng discrimination sa workplaces nila. And that should not be the case. Hindi bawal po tayo mag-discriminate ng mga workers kahit po sila ay may TB. So dapat mayroon tayong mga programa na written policies and programs on this. Next, of course, is we have Hepatitis B Policy. So pursuant naman po sa DOLE Department Advisory Number 5, Series of 2010. So sasabihin nyo, hindi to prevalent sa workplace namin because hepatitis B is, I believe it's blood-to-blood yung transmission natin. Okay? So, pero under the OSH requirement, lahat po ng establishmento are required to have their policy and program on the prevention and control of hepatitis B. Okay, so because you know what, many job applicants, kung narinig nyo na, may mga applicants who are, sad to say, became positive with HB, yung antigen testing nila, naging positive, and they are already declared unfit to work. Okay, without appropriate medical evaluation and counseling. Now, and these individuals are otherwise healthy and can be gainfully employed. So instituting this policy should eliminate the discrimination against HEPA positive workers. Okay, so hindi natin kailangan, and this should not be a reason to terminate a worker. Okay, these three policies and programs, this will be, kahit naging positive ang worker natin sa HIV and AIDS, TB, hepatitis B, these are not grounds for termination. Okay? So let's check kung meron ba tayong policy and program on the prevention and control of this particular aspect sa health natin. Next, on your OSH, number 6 on our OSH compliance indicators is we have the decomposition of your OSH committee. So meron tayong requirement na dapat meron tayong Occupational Safety and Health Committee. So i-organize natin yung committee natin. This is in accordance naman dun sa Section 13 sa OSH law natin. So the OSH committee shall effectively plan, develop, and oversee them and monitor the implementation of your OSH program. So sila po nagplaplano lahat ng mga programa niyo sa safety and health at nag-evaluate kung effective ba yung mga programs natin. So mayroon po tayong requirement depending on the type of establishment, yung risk classification natin. So kaya sabi ko, it is deemed necessary that you have to classify your establishment according to its risk. Ano ba yung establishmento ninyo? Low risk, medium risk, high risk. Because kung pag-uusapan natin on the composition of OSH committee, one of the criteria that you have to consider is the classification of your establishment. Okay, I'll give you an example. For example, establishment with less than 10 workers and low risk establishment with 10 to 50 workers, meron po tayong sinasabi, ito sa category A natin, okay? So, meron tayong requirement that it should be composed of a chairperson, secretary, and the member. So, secretary should be the safety officer, but of course, for this type of establishment, so mga maliliit lang, less than 10 workers, the safety officer of the workplace may also be the owner or the manager or his designated representative. Okay? So, ito naman sa B. So, karamihan po sa mga manufacturing industries, I think they belong dito sa B. Okay, lalo na yung mga food industries, marami po tayong mga workers, and usually food industries and beverage industries, they fall under medium to high risk. Okay? So we have to check kung ano ba yung classification at ilan yung workers natin to determine kung anong klaseng what type of OSH committee should we need. So for type B, we have ex officio chairperson. This should be the highest ranking authority. Then we also have your first aider, and you have your ex officio members, yung occupational health nurse, your dentist, your physicians, and of course member of your yung worker as member. Okay. So ito, check natin po kung meron tayo nito. The next is we have the requirement for OSH personnel and facilities. Mind you, we have to look into this because the new law, meron na po tayong penalties, monetary sanctions po. So meron pong involved na yung penalty natin ngayon sa OSH law natin. So you have to be very careful and you have to check that you are indeed compliant. Okay, so OSH personnel and facilities, so kailangan meron po tayong safety officers, so meron po tayong of course, yung safety officer natin, dapat may training. So just check doon sa table natin sa Department Order 198 kung ano ba, ilan bang safety officer ang kailangan sa workplace ninyo. Okay? And yung safety officer nyo should have the training. So ika nga, dapat competent yung safety officer natin. Okay? So, and meets the minimum requirement to be a safety officer. So i-designate siya ng employer. Okay, and of course, your occupational health personnel, kung kailangan ba first aider lang, or kailangan ng occupational health nurse, occupational physician, or occupational dentist. So you have to determine this for you to be able to check if you are compliant with the requirements on occupational safety and health. Now, for your health facilities, check nyo. Okay, so dapat meron tayong mga emergency medicines. So sabi ko na kanina, meron tayong table 47. You have to refer there para malaman nyo kung ano ba yung contents ng mga first aid kits natin or first aid boxes natin. Then you should have your treatment room. So this one, it will vary kung ano bang required sa inyo. What is required for you? Is it just a treatment room? Or do you need to have a clinic, a hospital, and of course, the requirement for a dental clinic? Okay. So next is we have the safety and health promotion, the training and education. So are you compliant with the requirement on the orientation of all your workers? So ito sa number 8 natin. So the 8 hours OSH orientation of all workers, it should be conducted by the company's safety officer or by any certified OSH practitioner or consultant. Other specialized training. So on top of the 8 hours training, that is mandatory for all workers, irregardless kung ano yung trabaho nila sa workplace ninyo. So there are also specialized training that are required that shall be conducted if applicable in the food manufacturing industries that have, example, mga food manufacturing industries, they have these chemicals, different chemicals. So if you have chemicals in your workplace, so you have to conduct safety on the use of chemicals in the workplace for those who handles chemicals. And that should be in place. Okay. Another is in the manufacturing of alcoholic beverages who have storage tanks, diba? If you have seen alcoholic beverage manufacturing industries, they have large tanks, silos for the storage of the raw materials, and these are considered as confined spaces. There are times that these confined spaces, okay, nagtatrabaho dito yung mga workers natin. Okay, special work, special activity such as maintenance, welding, okay? So kung may mga kailangan gawin inside those confined spaces. So for those workers who might be exposed to such workspaces, okay, they shall have a special training on confined space entry. Okay, so of course, before you have the training, may requirement din po tayo that you have the program on your confined space entry program. Okay, so mama, i-discuss din natin a portion of that. And of course, other training shall be conducted depending on the activities. So sabi ko, it varies from one organization or company to company. So kung ano ba yung mga hazards meron dun, hazards on the equipment, what equipments you have, okay, pressurized vessels that you have that could pose risk to your workers. So you have to conduct special training for those workers who will be affected by this or who are exposed to this particular equipments. So it's necessary that you have to identify this. So appropriate training should be given to them. So another, in addition to the mandatory training for your OSH personnel, is the requirement for a continuous training. So meron tayong mga continuous training na kailangan. Okay, so example is the 8 hours refresher course training for your occupational health personnel, which is mandatory at least once a year. So hindi porket tapos na kayo sa 40 hours mandatory training for safety officer or the 50 hours training actually it's just 40 hours training, but ONAP is conducting it for 50 hours training for the occupational health nurse. And I think it's 68 hours, I forgot, okay, for the occupational position. So there is also a requirement that you have to do refresher courses. So at least 8 hours training in a year on top of those mandatory trainings. So if you also have works that deals with hazardous energies and hazardous processes, the need for a work permitting system should also be there. Okay? So kailangan po natin i-check kung ano yung mga permitting system na kailangan sa workplace natin. For example, if your company is doing some hot works, so dapat meron tayong permitting system on that particular activity. And your workers should be educated, meaning to say, they should be informed on the system. Alam nila kung anong mga gagawin, alam nila kung ano ang kailangang gagawin. Okay? So you have to make sure that you have this. Number 9, of course, you have to conduct safety meetings. This is on top of the meetings that the OSH committee is conducting at least once a month. Okay, so meron din tayong mga meetings required for the OSH committee to conduct at least once a month. Recorded din po lahat ng meetings nila. Okay, so actually for manufacturing industries, we do not call that toolbox meeting, but that is interchangeably with safety meetings. Pwede po natin tawagin yan toolbox meeting if you want to. So at the start of your work, you can do a short meeting, a short discussion on the things that you're going to do. Now, this comes in also especially if there are activities na hindi siya routinary. Okay, so ngayon lang namin gagawin. Like example for maintenance of your equipments and machineries. So before the start of the work, you have to conduct safety meetings. And all these meetings should be recorded. Okay, so may record po tayo, may minutes of the meeting tayo para i-check natin kung ano yung mga na-discuss natin, ano yung mga napag-agree natin. Okay? So you have to determine also the frequency, the duration of your safety meetings. Okay? So next is we have to check if you are compliant also is on the reportorial requirements for number 10. There are OSH reports. This report should be submitted to DOLE. Okay? So meron tayong mga reports na reports on the Safety and Health Organization. Actually, your Safety and Health Organization, that should form part of your OSH program. Kasama dun yun sa format natin that you have to put on the organization of your health and safety. So, recommended po that every year you have to reorganize. Okay, only for the members because there are some members of the OSH committee that cannot be replaced, okay? So mga ex-officio members. So one reportorial requirements that is mandatory is what we call the annual medical report or the AMR. So this must be submitted on the last day of March or March 31. Okay, so yung isasubmit natin po yan sa DOLE. Okay, next is we have, actually, the good thing about the submission of these reports, meron na po tayong online submissions. So you just go and check with the website of the Bureau of Working Conditions. Meron po tayong doon kung saan pwede kayo mag-submit ng mga reports ninyo. Of course, if you want, you can also submit to the department, AMR, sino bang dapat mag-fill up ng AMR natin? As much as possible, we recommend that it should be filled up by the occupational health personnel. Okay, so sila po dapat ang mag-fill up. But of course, pwede din po si safety officer kung may knowledge and training naman si safety officer. Another reportorial requirement is your work accident injury report. So to be submitted for work-related cases resulting to disabling injuries or conditions. So alam na yan ng mga safety officers when we say disabling injuries or conditions, these are accidents that result to at least one day, one lost time, okay? Lost day, I mean. So meron nag-absent si worker ng isang araw, buong araw, dulot ng aksidente. Okay? So these are considered as disabling injuries. So these reports should be submitted on the 20th date of the following date of the accident, following month of the date of the accident. Okay? So, WAIR naman, mayroon tayong additional for your WAIR, which is the COVID-19. Okay, so I just remember this one. Okay, so I'm sorry I wasn't able to add this on my presentation. We have the WAIR COVID-19. I hope you are complying with this already because it has started already. So this submission is every end of the month. Now the WAIR form, the WAIR COVID-19 should be submitted to DOLE with or without COVID cases. So remember to submit it every end of the month. Ito yung additional natin sa reportorial requirement for your OSH reports recently being added. And of course, your annual exposure data report. So you have to check, kayo ba may report na sa annual exposure data report ninyo, which should be submitted on the 30th of January. Okay? So lahat po ng mga occurrences of accidents and illnesses in your workplace should be reported. Dito po sa AEDR, kailangan po natin isulat yung severity rate and the frequency rate. Okay, so safety officers, I know you are well versed in computing for this severity rates and the frequency rates. So dito po yun doon sa AEDR natin, nilalagay natin yung mga indicators natin. Okay, next is the provision of personal protective equipment. So ang company nyo ba ay compliant to this? Thus your company gives free personal protective equipment for those who are exposed to the hazard. So the employer shall provide necessary PPE to all workers who have exposure to the hazard and should be free of charge. You should ensure that all PPE should be of approved design and materials, appropriate for the exposure and the work to be performed. So marami po tayong mga different types, different classes of PPEs. So you have to determine what are the hazards and what is the appropriate PPE for that matter. So the company should also have a policy and program on the provision, on the use, and the maintenance of the PPE. Hindi po yan porket bumili na si employer ng PPE, bigay na lang agad kay worker. No, you have to make sure that you also have the policy and program on the PPE, lalo na on the safe use and maintenance of this personal protective equipment. So you have to check if you have your policies already on the provision of personal protective equipment. Next is, do you have the provision of safety signages in your workplace? Meron ba kayo yung mga minimum requirements? Visible ba ang mga signages natin? Understandable ba sa lahat ng mga workers natin yung mga signages? So if you want to be strict on the size of your signages, you can go ahead and check our you check table 2 of the Occupational Safety and Health Standard po. Nandun po ang standard colors of signs and safety instructions and warnings na kailangan sa mga premises natin. So nandun din po yung color. Okay, so you have to compute for the size of the signages if you really want to be strict on the implementation of your safety signages. Okay? Of course, nandun din po ang angkop na color of your signages. So check your workplaces, kung may mga hazards kayo, mayroon ba tayong mga warning signs na nakalagay doon sa mga hazards, doon sa mga areas that need to be taken into consideration na dapat mayroon tayong mga precautions. Number 13, may provisions ba kayo for workers' welfare facilities? So check nyo. So dito, adequate supply of safe drinking water. I heard this last time na mayroong mga employers nagbibigay daw ng free water na piso-piso. And that is not for free. Diba? You have to pay 1 pesos yung mga piso ano natin. Okay, so I hope hindi ganyan mga employers natin. Dapat po libre po. Surely, sa mga beverage industry, these are for free. Ang dami nila nito. So, libre po. Okay, so walang question dyan. Even yung mga bottling soda companies, I think they also give free sodas. But of course, that is not part of the requirement. The only requirement is adequate supply safe drinking water. Okay, so with facilities, ito naman, so adequate sanitary and washing facilities. You should have living accommodations. Now, these living accommodations, if applicable only, okay? So, usually, ito yung mga sa call center agent, sa call center industries. So, separate sanitary, washing, and sleeping facilities kung applicable lang sa inyo, okay? So, and of course, the requirement for lactation station. Now, with facilities, meron siya sa lactation station, dapat meron siyang ref or cooler, may table and chairs, may sink with running water or washing facilities. Okay, so allowing there should be a paid lactation break. So dapat may policy kayo, okay, on this. Kasi yung lactation break na binibigay natin sa worker natin, which should not be less than 40 minutes for every 8 hours, okay? So this should be paid break po ito. Okay, so observe lactation equivalency for establishment with peculiar circumstances. Ito naman, minsan kasi wala tayong mga enough spaces. So you check yung issued by DOLE on the lactation equivalency, kung ano bang pwede i-implement nyo. Else, meron din po tayo na pwede po kayo mag-secure ng exemption certificate. Okay? So, exemption certificate from DOLE pursuant to Department Order 143. Kung, say for example, wala kaming worker na babae, ma'am, so that is justifiable that there's no need for you to have the lactation station. But you have to secure an exemption certificate from DOLE, okay, pursuant to Department Order 143. Okay, so that's it for your workers' welfare facilities. Then you have to conduct your emergency drills. Mandatory po, meron po tayong mga drills. Just, I think last week, there was a nationwide na earthquake drill. Sa to say, naging reality yun sa Cagayan de Oro City. During the time of the drill, naging actual po siya, hindi po siya naging drill. Okay, so kasi nagkaroon talaga ng earthquake sa Cagayan de Oro. And this is very important for us to have these drills. Okay, so drill should be conducted depending on the nature of your work and workplace and the potential emergencies. For example, you have bulk chemicals. Okay, you are storing chemicals in bulks. So there's a possibility that you have chemical spills, chemical explosions, if these chemicals are also flammable. So you have to make sure that you conduct drills for this specific potential emergencies in your workplace. Example, you also have boilers. Okay, boilers can explode. Okay, so you have to conduct a drill for this. So you have to check what specific potential emergencies that could occur in your workplace, and you have to conduct emergency drills for this. Okay, and this should may form part also on your emergency preparedness and response program. Okay, so yung mga emergency preparedness program natin and response. So parte po yun yung emergency drills natin. Then, of course, number 15, you check if you're compliant with fire protection on the requirement for equipment and facilities. Kayo ba may fire extinguishers? Angkop ba yung fire extinguishers natin? Okay? May mga classes yan, mga type, depending on the hazard in your workplace. What type of fire hazard you have in your workplace, you have to determine that for you to be able to determine what type of fire extinguishers you should have. And these fire extinguishers, ang nangyayari po kasi sa mga fire extinguishers, hindi na ini-inspect. Okay, mandatory po, mayroon po tayong inspection program for this, inspected monthly. Okay, so lahat po dapat ini-inspect natin monthly. And of course, during drills, kung pwede, i-check din po natin if all these are working. Your fire hoses, your fire detection devices, okay? But of course, not all establishment requires fire detection devices. Okay, so you just have to check also the requirement on the revised Fire Code of the Philippines. May mas detalye din po doon yung requirement natin when we talk about fire protections. Okay? So, for exits, at least required po per floor area na meron tayong 2 fire exits. Okay? So, minimum po yan. But of course, it varies kung masyadong maliit naman yung workplace ninyo. So, one fire exit is enough. Okay? Now, next is we have the requirement for the compliance on the permit to operate for your industrial machines. So, check nyo, lalo na sa mga manufacturing industries natin. Okay, so sa mga food and beverage, mayroon tayong mga boilers. Those who are using steam as their source for energy in their processes. Okay, so you use steam for your ovens or other machineries. So you use this as source of energy. Okay, so you have to make sure that you have all your permits. And because these are bound, they have the requirement for a technical safety inspection for this at least once a year. So you have to make sure that updated po yung mga safety inspections natin for this particular machines in our workplaces. Kung meron po kayo, lalo na sa mga food and beverage na talagang meron po tayong ginagamit na mga boilers, pressure vessels, okay? So pressure vessels required din po also that it should be, meron po tayong technical safety inspection for that. So, example for these pressure vessels, kung meron kayong mga bulk liquids, lalo na yung mga hot liquids, corrosive liquids, or corrosive chemicals under pressure, like ammonia, if you have ammonia, which are sometimes under pressure. Okay, so you have your vapors and other gases. Okay, so these are usually stored more than 15 psi. So another is for your combustion engines, kung meron kayong mga combustion engines that uses fuels, your elevators, okay, piping lines, crane and hoist, usually mga manufacturing industries na mayroong malalaking mga warehouses, they have these lifting equipments, okay, for para wala pong manual handling. Okay, they also, and of course, you have to check your electrical wiring installation inspection. Okay, so ito po yung mga necessary to check if you are compliant on the requirement for occupational safety and health. Okay. Next is, do you have a program on good housekeeping? Alam nyo, marami pong mga aksidente nangyayari because of poor housekeeping. And yet, housekeeping is a very simple program, sabi nila, but very difficult to maintain, to sustain. Okay? So you have to make sure that your program on 5S is in place and all these programs are implemented. Okay, you evaluate, you monitor the implementation and the efficiency of this or effectiveness of this program on the housekeeping. Okay, so you may refer also to Rule 1060 for the tools on housekeeping. Okay. So number 18 is, oh, this should be number 19. Apology for the incorrect numbering. Okay, so number 19 is the proper handling and storage of materials. So we have actually the DOLE Department Order 1360 series of 2014, also known as the Guidelines for the Implementation of Globally Harmonized System in the Chemical Safety Program. So kayo, kung may mga chemicals kayo wherein I'm sure lahat kayo ay meron because meron kayong mga sewage, water treatment, di ba? Sewage treatment plants, water treatment plants ninyo, and you are using chemicals for these treatments. So meaning to say, you have handling and storage of these chemicals. So you are required to comply with DO 136, yung implementation of the globally harmonized system. At dapat meron kayong chemical safety program. Okay, so lahat ng workers are informed about your program. They have the training about the safe use of chemicals in the workplace, lalo na yung mga exposed. So you have to ensure that properly labeled lahat ng chemicals, dating or markings on the areas wherein these are being stored, because you have to ensure also that these are properly stored. Okay, the storage condition requirements, should it be stored in a dry area and closed environment with ventilation? So you have to check. Okay, so you have to make sure that you have your chemical safety program for this matter. And part of your chemical safety program is the proper handling and storage of these materials. Okay. So number 19 is the requirement. Ito, karamihan po na-violate talaga to. Hindi po nagkakandak ng work environment measurement. But this is a requirement under Rule 1070, mind you, that all establishments, especially manufacturing industries, should undergo at least once a year work environment measurement. Why? You have to check what is the level of lightings in your workplace. What is the noise level in your area? Because for those noise level that exceeds the limits or within the action level, you have to make sure that you have your program, okay, your policies and programs on the prevention of induced hearing loss. You have to make sure that if you are using equipments that emits radiation, you have to have your radiation exposure control. Proper ventilation. Okay? All workplaces required proper ventilation. Lalo na ngayon sa pandemya, 'di ba? Meron tayong specific doon sa guidelines, sa DTI DOLE guidelines on the ventilation requirement in your workplaces and even on the buses or the transportation for the employees. Okay? So, and we have to maintain the airborne contaminants in our workplaces to ensure na workers natin are always safe. They are exposed to a safe working environment. So, this is mandatory po at least once a year that you have to conduct your work environment measurement. Then, of course, number 20, you should have your procedures in performing hazardous work or work that deals with hazardous energies. Okay, so yung mga work, lalo na hazardous energies that are done in an underground tank. So hazardous energies, exposed kayo while inside a confined space. That is very important. So this is also in related to the mentioned earlier doon sa item 8 natin on the list of OSH compliance indicator that you have to formulate procedures or the programs if you have exposure to or you are using hazardous energies. Ano ba yung mga hazardous energies? Chemicals, okay? Hot liquids. Ito, mayroon silang mga hazardous energy. Electrical energy, okay? Electrical source. Mechanical energy. These are all hazardous energies that could possibly lead to accident and illnesses if there's no preventive control measures in place. Okay, so you have to make sure that you have procedures for this. Okay, and of course, work permit system. Okay, so kanina I have mentioned about this, about the training of your workers, that if you have your work permit system, you have to ensure that your workers are being educated. They are informed about your system. Otherwise, there will be a failure on the implementation of your work permit system if the workers themselves are not informed, are not educated on the system that you have. Now, this defined procedure, you may check also Rule 1120 of the standard for hazardous workplaces, okay, or work processes. So you have to check if there is a need for you to do your work permit system, especially for workers or workplaces na meron kayong mga hot works or yung mga sa nagkakandak ng mga maintenance of big machineries. Okay, so pag nagkanda kayo ng maintenance ng mga malalaking equipments ninyo, you have to make sure na mayroon kayong work permit system kasi mayroon yan mga hazardous energies. Okay, so you have to ensure that meron tayong procedures, meron tayong programa to ensure the safety and health of our workers. So kasama na dito yung mga lockout, tag-out systems natin. Okay, so yung mga loto natin, isama na natin dito. So, and of course, last is we have others. So, ano pa yung mga iba na hindi ko na-mention? You can check if you are already compliant with the DTI DOLE. Ito yung bago natin, Supplemental Guidelines on the Workplace Prevention and Control of COVID-19. So, check also if you are compliant with all the requirements of these guidelines. And of course, for those manufacturing industries that are using steam, they have boilers, you have heat exchangers, you have processes that involve heat. Okay, so your workers might be exposed to heat stress. Okay, so you have to have your heat stress management. So check nyo, yung mga bakeries natin, yung malalaking ovens. Okay, so sa food manufacturing industries, your workers might be exposed to heat. So you should also have your heat stress management program in place, being practiced and implemented in your workplace. Check also if you have the exposure, your workers have exposure to prolonged standing. So you refer to Department Order 178, gumawa kayo ng programa, okay, naaangkop doon sa Department Order 178 kung meron po tayong mga workers that who by nature of their work have to stand for a long period of time. So you check, you have to make your policy and program on this to ensure that you are compliant with DO 178. And of course, the other is the DO 184. If your workers naman, yung nature of work nila is they have to spend long period of hours sitting. Okay? So these are some of the new orders that are mandatory for establishments to have. So these are mandatory for food manufacturing industries and beverage industries. Okay. So those are the OSH indicators that you need to check in your workplaces if you are compliant, to make sure that our workers are always safe and healthy. Okay, so that's it for the different OSH compliance indicator that you are required to comply as applicable. Okay, kung applicable lang po sa workplace ninyo. Okay, so the Occupational Safety and Health Center is with you in ensuring the safety, okay, and health of our workplaces and our workforces. Okay, so we're always just an email away, a text away if you need our assistance for you to be compliant with all the required occupational safety and health requirements. Okay? So lahat po tayo ay pwede maging OSH champions. Hashtag po ligtas ang maingat. Thank you and good morning everyone po.
Thank you very much, Engineer Diaz, for sharing your inputs and expertise and a comprehensive discussion on OSH compliance and guidelines in the food and beverage industry. Thank you very much, Mami Ellen. Can you please stay for some questions and clarifications later on from our audience during the Q&A segment?
Yes, Sir Melvin. Thank you.
Thank you rin po. Now, ladies and gentlemen, please once again remind everyone, if you're not talking po, can you please mute your Zoom application? Once again po, for those who are not permitted to speak,